Imagine having a clearer picture of your brain health much earlier than ever before. What if a simple blood test could offer insights into changes happening in your brain long before noticeable symptoms appear? Alzheimer's disease blood test results indicate the presence of specific biological markers associated with Alzheimer's pathology in the brain. They can suggest the likelihood of amyloid plaques or tau tangles, which are hallmarks of the disease, but they do not provide a standalone diagnosis. These tests primarily measure levels of proteins like beta amyloid and phosphorylated tau, often referred to as p-tau. In Alzheimer's disease, beta amyloid proteins can clump together in the brain, forming plaques. Similarly, tau proteins can form abnormal tangles. These blood tests detect how much of these proteins are circulating in your blood, and changes in their levels can reflect these brain pathologies. For instance, lower levels of specific beta amyloid fragments or higher levels of certain p-tau forms like p-tau 181 or p-tau 217 typically suggest the presence of Alzheimer's-related brain changes. Other markers, such as glial fibrillary acidic protein, or GFAP, and neurofilament light chain, can also provide information about brain inflammation and neuronal damage. Understanding your blood test results for Alzheimer's disease always requires a thorough discussion with your doctor. These tests are not diagnostic on their own. Instead, they are valuable tools that a healthcare professional uses in combination with other evaluations, such as cognitive assessments, neurological exams, and potentially brain imaging like PET scans or MRI scans. Your doctor will interpret the results within the context of your overall health, symptoms, medical history, and family history to provide a comprehensive picture and guide any next steps. The development of these blood tests represents a significant leap forward in Alzheimer's research and clinical practice. They offer a less invasive and more accessible way to screen for the presence of Alzheimer's-related changes compared to traditional PET scans or cerebrospinal fluid tests. This early insight can be crucial for identifying individuals who might benefit from lifestyle interventions, participation in clinical trials, or future disease-modifying therapies, potentially years before clinical symptoms manifest. They also help differentiate Alzheimer's from other forms of dementia. Ultimately, these advanced blood tests empower you and your healthcare team with earlier and more accessible information about underlying brain changes. By providing an indication of Alzheimer's pathology, they facilitate informed conversations and proactive planning, helping to navigate the complex landscape of brain health with greater clarity and confidence.